Good morning, everyone. Welcome to Org 610 Nonprofit Program Plan Evaluation. This is my Week 2 Connect. This week, I want you to put two characters in your mind. The first one is Curious George, if you remember from grade school days, the monkey that was very inquisitive. And the second character is Mickey Mouse. I want you to kind of put both those two characters together. Because in this week, it's all about noticing, listening, and identifying. What's the problem that you see? I want to know more about that. I want to get deeper. And that's the Curious George part of the character. Wanting to get in and really understand the guts of a problem before you even think about the solution. And then the Mickey Mouse part, the ears, that's listening. Spending a lot of time paying very close attention to what you're seeing, to what you're hearing, to what people may be feeling. Now, the reason I want you to think about those characters is that I want you to think about the symptom versus the illness. Now, I know we've just come through COVID. And so the thing is if you remember COVID, there's lots of different symptoms. So if a person shows up to the doctor and let's say that person has a cough, but they're really carrying COVID, and the doctor just gives them cough syrup to take care of the cough, well, then that person has got a very good chance of becoming even more ill. And you know the effect of that, right? So that person could end up in the hospital, can end up in ICU. It may even kill them because the physician was treating the symptom and not the illness. And so as we're being curious, we're listening, we're trying to get to the underlying illness of what's going on and not the symptom. The symptom is just that. It's how that problem is manifesting itself. It's how the illness is manifesting itself. So that's the focus. Now, the tips for this week, completing your assignments, make sure that you do the prep work for the interview that you've got coming up on Friday. So you're going to have the Brian Nelson interview that's on YouTube. Make sure you watch that. Make sure you take notes. Be curious. Really listen to what's going on. The second thing is to read Brian's notes, his document that he sent out about Maui Rescue Mission. And then make sure to submit a few questions, 2 to 3 questions to me by Thursday evening. Because those are the questions that I want you to be able to ask Brian in this session on this coming Friday. So those 3 pieces all work together. And then for more completion of the assignment, I want you to think about contextualizing and personalizing. So when you answer a question, I'm really interested in knowing how the question is asking you to how things are going to pan out in your organization and in your setting. It's fine to talk generally, but I'm very interested in how things will work out specifically in your organization, how you see things working out in that setting. So that's what I'm really going to zero in on, is this idea of contextualization and personalization. Now, there's a couple of books that I want to throw out at you, some perspective here. So the Department of Health and Human Services, specifically the Office of Family Assistance, has got a guide out there. It's called the Implementation Resource Guide for Social Service Programs. It's an introduction to evidence-based programming. Now, it's a beast, but it may be something you may want to download to put on your bookshelf, another resource that you can look into. Now, for the purpose statement is one of the ways to get at that is to pull in a focus group if you can, a few people, if you don't have one already, and really listen to common words, themes, and phrases when you're talking to them about this program. So you've brought people together, you've done the needs assessment, you know what the problem is. Well, how are you going to solve it? And the whole program zeroes in on this purpose statement. So again, pull people in, different stakeholders, and what they envision the purpose of this program to be. And again, pay attention to those signal words, catchphrases, try and group that and really zero in and crystallize what that purpose statement is going to be for the program. Now, here's a key point. Have someone else do the recording and you do the facilitation. If you try and record everything that's going on as well as facilitate, you're going to miss things. You're going to miss body language, pardon me, and you're not going to record as accurately. So I really encourage you to have someone sitting there taking notes that's not part of the process, that can be an objective person as they're taking down the notes. Okay, so this week is all about the first phase of your theory of change. If you have any questions, please don't hesitate to reach out and ask me. And just a reminder, the way I grade is accumulation. So as soon as your forum comes in, your initial post, I'm going to assign points to that. And the reason you don't have an A yet is because you haven't responded to everyone yet. And so as each response comes in, I add points. I emphasize this, I'm an accumulation grader, not a deficit grader. I don't wait till Sunday and remove points. I start off with the very first submission I see you add, and then I start adding points from that point on. Okay, that's it for this week, and I'll see you next Friday in the Zoom session with Brian Nelson and the Maui Rescue Mission.